A crisis situation like the COVID pandemic affects our mental health for a number of reasons, largely because it's very unpredictable and we don't have any experience to compare it to. So the fact of it being something that is changing all the time, new information, new news, it puts us into crisis mode because we're on the alert for what's coming next, which we can't anticipate. The fact that we don't have any experience to compare it to means that our bodies don't know what's the right reaction, even trying to respond to it as a crisis. Is it fight, flight, freeze, something else? So many people are finding themselves cycling through different types of reactions, sometimes feeling very revved up and elevated, sometimes feeling very tired and passive or avoidant of the whole thing. And it also can contribute to stress and anxiety by having a sense of feeling trapped, which could come up a couple of different ways regarding COVID. One is that a lot of people are being asked to stay at home, and that can have be associated with the idea of feeling trapped. Some people feel really stuck by the requirement to continue going into work. They may be worried about their own health or about infecting family members. Some people feel trapped by not being able to go help others. And everybody is susceptible to reacting to the fact that this is really out of our control. There are many, many things about COVID that we can't control, and that itself can create a feeling of being trapped. Some of the things people may be experiencing are feelings of fear, which can come across as your heart racing or a tightness in your chest. People may find themselves more irritable than usual, impatient, restless, snapping at people when that's not usual for them. There may be sadness, crying, low energy, trouble concentrating, trouble doing regular daily tasks. Some people might find themselves having moments of happiness or relief, maybe because they get to work from home, spend more time with family, or have a break from situations at work, and then they may feel guilt about feeling happy. A lot of people, as I mentioned before, a lot of people are cycling through some or all of these feelings or just experiencing a general sense of stress or overwhelm. People may find that they're having trouble sleeping, eating more or less than usual, starting to use alcohol, drugs, or tobacco at a different level than before, and having constant thoughts of, I can't handle this, what if something terrible happens, picturing kind of the worst case scenario. All of those symptoms are likely to be especially strong for people who already had mental health conditions. Those are some of the types of things that people experience when they're coping with anxiety, depression, or any other mental health situation. So COVID is really, whereas for some people it's going to create a new sense of anxiety or stress, for people who have already been dealing with a mental health challenge, it's really going to elevate what they've been experiencing, possibly to really difficult levels. It's not surprising at all that people who have no history of any mental health challenges would find themselves experiencing stress, anxiety, depression under these circumstances. And I hope that people know this doesn't mean anything negative about them. Also, for people who have any pre-existing mental health conditions, that or new stress or anxiety, that's not something that reflects negatively on anybody having those feelings. This is a really difficult situation, and it's natural that our minds and our bodies are responding to it. People can try a lot of different things to feel better. Again, these apply whether somebody has a pre-existing condition or whether these symptoms are new. There are things that people can do at home. I'll go over a couple of ideas in a moment, but also people should gauge if you're really experiencing a lot of distress, if it's making it hard to cope with situations at home or things that are going on at work, if you're really not feeling yourself, or certainly if people are having any thoughts of hurting themselves or anyone else, absolutely they should immediately reach out for help. But some things that people can do at home, there are a couple of different categories of ways that people can help themselves and reach out to others on a personal level to feel better. So first of all, it's important to validate the feelings that you're having. As I said, it's really normal to be having a lot of intense feelings about this situation. And those feelings are this might seem paradoxical, but they actually will go away faster if they're expressed than if they're pushed away or avoided. So some ways to validate your feelings are to write in a journal, to talk to friends and family about how you're feeling. Even though they're going through it as well, it'll actually help both of you to make that connection. Somebody who's already seeing a therapist can call and talk to their therapist, or I'll say in a few minutes, people can reach out to someone new. People can validate their feelings by accepting that they don't like the situation. It's okay not to like it. None of us like it. We all wish it would go away. And it's okay to feel that way. Again, there's nothing wrong with having distressed feelings about what's going on with COVID. We need to recognize this is a crisis situation, and we all need to be gentle with ourselves and compassionate.